right, part 2, as I promised, right? Electrolytes, how and where they work. This time, we want to highlight a concept that we know for sure shows up on examinations. I mean, not that the other ones don't, because they do too. But this one, you'll find at least, I don't know, a good three, maybe 4 questions on your examinations when you're getting tested in fluid and electrolytes, right? So let's dive deeper into this. Okay, so what are we doing at Cliff Notes? Helping students to see through larger concepts. And you got it. So we're numbering our paper this time from 1 to 5, or your device, whatever you're using. Okay, and here's why you're numbering it, because, all right, the very first thing we're going to have you do is define what tetany is. What is tetany? In your own words. What comes to mind? What is tetany? Okay, and next, pause if you need to. Tetany, a condition marked by intermittent muscular spasms. That's real key. Muscular spasms, right? Caused by malfunction of the parathyroid glands and consequent of the deficiency of calcium. So basically, tetany, you experience that when you have hypocalcemia. Your calcium level's too low, you tend to suffer from tetany. Okay? And now, 2 and 3. What are the 2 classic signs of hypocalcemia? So if you watched the previous video, you know hypo is low, calcium in the blood, anemia, hypocalcemia. So there's a low level of calcium in the blood, and what 2 classic signs go with that? All right, and here's the picture. So we've got our gentleman here, and someone's tapping or touching near his face. And for number 3, the same gentleman has a blood pressure cuff on his arm. All right. And for number 2, you should have chopsticks. Chopsticks. Chopsticks is where a person experiences tetany in their cheek. Now, sometimes they'll just do it on their own, depending on how intense their hypocalcemia is. Sometimes you have to elicit that response by tapping that person just in front of their ear. And when you do that, that stimulates the nerves, and they kind of can't help but making this twitching motion in their cheek. That's chopsticks. By the way, all right, let's go there. So, kind of goofy, but what do we say? Goofy works sometimes, isn't that right? All right, so let's get ourselves to things to be our chopsticks, yes? Okay, so you take your chopsticks, and what do you do with chopsticks normally? And yes, sounds like chopsticks. Yeah, so you take chopsticks to do what? Right? You bring them up to your mouth, right? To eat. Chopsticks. The twitching in the cheek. Okay, good there. All right, next up, after the chopsticks, we've got trousseaus, which is T this time. Twitching in that patient's arm. Now, I want you to realize that that patient had a blood pressure cuff on their arm. Okay? And let's get into that and show that for a minute. Okay, so trousseaus, right? What do we say? T, twitching in the arm. But what brought that on? Now, depending, again, on how intense the hypocalcemia is, they may already be twitching. But if you have to elicit that response, you put a blood pressure cuff on that patient's arm and start to pump it up. And as you pump it up, you'll see that patient's arm twitches like we have here in the picture. So, chopsticks, C, cheek, tetany. Trousseaus, T, twitching in the arm. Yes? Good. All right. So that brings us to number 5. And this one is, blank is the hormone responsible for maintaining homeostasis of calcium in the body. What is the hormone responsible for maintaining homeostasis in the body? Here, let's do this Let's do this all the way. So we want you to abbreviate it and spell it out, right? So the abbreviation and the spelling. All right, good. And you should have on your paper the following. PTH, right? Parathyroid hormone. Well, hold on. Let's give you some knowledge as we move through this. PTH, right? So when it comes to PTH, here's the way you want to think of it. PTH, parathyroid hormone. Not to be confused with thyroid hormone. Parathyroid, okay? Behind your thyroid itself lies your parathyroid. And that's something that makes it kind of difficult to study for some people. But if you were able to take a person's thyroid, right? You remove that person's thyroid, and I know you can't see it there in YouTube verse, but there's four little dots on this right here. And that would be like perfect, right? If this was a patient's thyroid and the doctor or the surgeon removed it because they had a goiter or something, when you turn it around, you have these 4 little pearls. But what? There's 2 on each side. And that's what? 2 pairs of parathyroid. 2 pairs. Parathyroid. That's where they are. Behind the actual thyroid gland. Okay? Yeah. All right? Another thing. We said that this handles the calcium level. And probably we'll have to do like another video about this to bring this concept, deeper into your mind. Parathyroid, you want to think of it almost like a seesaw, right? So if you had a seesaw effect going on, one side would be your bone, one side would be your blood. Bone, blood. Parathyroid helps to find balance between calcium levels in your bones and your blood. It's the hormone responsible for making sure you've got the proper level of calcium on both sides, your bones and your blood, right? Okay, so anyway, as we spell that out, parathyroid hormone, we said, is responsible for maintaining that, balance in the body, homeostasis? Absolutely. Good. Okay. Well, the end, guys. Thanks again for subscribing and liking. All right, stay tuned. Steady smart.